Hey everyone, welcome to our discussion of infant assessment. Did a little research to look into just how many infants are born in the U.S. every year. There are 3,855,500 infants born yearly in the United States. About 8.3% of those are born low birth weight. 9.9% are born preterm. We know that is before the end of the 37th week. The mean age of the first birth, the mother, when she has her first child, is 26 years and 8 months. Kind of interesting. So you're going to be working with some young ladies that are going through a huge transition, and you may be called to the delivery room and may be a part of something very big in their lives and in the lives of their newborn, and that is the assessment and care of that newborn. It's not always beautiful like it looks in the movies. Sometimes it gets really stressful, and we need to be there to do our part. So we're going to be there to maintain the airway, to assess the patient, and help clear any issues that the infant may have at birth or shortly thereafter. So when we assess these infants, the first thing that we're going to assess is their appearance, and we're going to use that APGAR score to look at what their condition is at minute 1, minute 5, and the 10-minute mark in order to decide if they need intervention. The higher the APGAR score, the better. We know that an APGAR score of 7 to 10 is a beautiful thing and means we just need to keep the baby warm and under observation. An APGAR score of 4 to 7 is a little bit more troubling and means that or 4 to 6, is a little more trouble and means that we need to definitely keep a close eye on the baby, continue assessment. You may have to intervene by giving some supplemental oxygen. You may have to intervene by clearing the airway. But if the baby has an APGAR score of 3 or less, then there's a possibility you may be involved in resuscitation efforts, and you may have to help with intubation, if not intubate yourself, and secure that airway and clear the airway of any meconium aspiration or any other issues. So lots of things can go right, lots of things can go wrong. So you have to be ready to handle whichever situation you're involved in. So as we are assessing the baby, we're going to see that normal pulse is 110 to 160, so a little higher than the adult normal range. Anything over 170 is considered tachycardia, and we've got to administer oxygen at that point to try to relieve that and help the heart not have to work so hard due to hypoxia. So we take that pulse either brachially at the elbow or femorally. We don't use a radial pulse on an infant. Any cardiopulmonary challenge will cause an increase in the infant's heart rate. That's just the way that the body responds to try to compensate for that. It doesn't mean that the heart's going to beat more efficiently. It just means it's going to beat faster. So we have to quickly correct any issue that's making the heart work harder. So in assessing the respiratory rate and pattern, we want to find a rate between 30 and 60 per minute is normal. Apnea up to 10 seconds is normal, but an apnea over 20 seconds is not normal and means we need to further assess the patient and decide what the issue is, and we may have to intubate. Something else that we can do in the newborn nursery to help the infant who has been treated for apnea is suggest caffeine citrate. But once that infant has received caffeine citrate to combat apnea, then we know that we're going to include an apnea monitor in their care plan during their hospital stay and once they have been discharged to home. So set up lots of apnea monitors in the past in some roles that I've had. Done a lot of patient and family education. So we have to really work with these moms, or if the grandmother is taking custody, sometimes it's not the mother, sometimes it's someone in the family. Maybe there's just a situation, so you have to be open to that and be willing to work with people of all educational levels in order to have them ready to use that apnea monitor well to protect the baby from emergencies or to help them quickly respond if there is an emergency. So any apnea more than 20 seconds, we need to definitely put the baby on a monitor. Suggest caffeine citrate to stimulate ventilation, and also treat the baby with supplemental oxygen, stimulate them by flicking the feet, rubbing the back, whatever we have to do to stimulate that ventilation is very important. So we don't want to decrease ventilation, oxygenation, perfusion by having apneic events. So we've got to treat that and correct it. We also want to look at blood pressure. 60/40 is normal for an infant. If it's preterm, they may have a lower blood pressure, maybe 55/35. So keep that in mind. The younger they are gestationally, the less their blood pressure is probably going to run. Body temperature, newborns are at high risk for hypothermia, so we have to make sure the baby is kept warm once delivered. Normal body temperature for a newborn is 36 to 37 degrees Celsius. We can use a radiant warmer or incubator once they have been delivered and the cord's been cut to keep them warm. They do lose body temperature super quick, so we have to wrap them in swaddling clothes and lie them in the radiant warmer quickly. So a lot of times if the baby is healthy though, and they have a positive APGAR score of 7 or more, then the infant is going to be placed with the mom for that initial skin-to-skin contact to help initiate bonding. So keep that in mind as well. If the baby's healthy, you're very rarely going to get a perfect score of 10 just because the huge transition the baby goes through from being in utero to being initially out into the world and have been gone through the birth canal or been delivered by C-section. So the birth canal is definitely a healthier route of delivery. It's more natural, and those pressures that the baby experiences as they come through the birth canal helps close some of the cardiac changes, and it also helps with removing fluid, and it's just a more natural route of delivery. Sometimes we don't have a choice though, and we have to deliver the baby by C-section, and so there may be a little bit more assistance needed once they are delivered in the delivery room. So keep in mind, make sure that heart rate is normal between 110 and 160. Anything over 170 shows some distress, and we need to administer oxygen. Take their pulse brachially or femorally, not radially, and make sure their respiratory rates between 30 and 60 per minute. Any apneas over 20 seconds is definitely not normal, and they need to be placed on an apnea monitor, and recommend caffeine citrate for stimulation and ventilation. And then they will need an apnea monitor included in their care plan for their time there at the hospital as well as after they're discharged. We know that that apnea is one of the causes of SIDS, sudden infant death syndrome, and we know that that can affect infants usually up to the age of 1. It is more prevalent in Caucasian male babies, so they definitely need to be monitored at all times. So keep that body temperature between 36 and 37 Celsius, and Just keep an eye on and assess frequently as needed. Thanks for listening.